Good night, everybody. Thank you for being here. I want to thank Brightbot for sponsoring this seminars. Today we're going to talk about one of the subjects that I really enjoy the most. I want to remind everyone and to tell the new participants that throughout the presentations, everyone's microphone is going to be muted. At the end, I will give some time for questions that, by the way, I enjoy a lot, especially in this subject. Also, I want to remind you that this is just a guide for you and advice in my personal opinion and experience. It never replaces a medical consultation. So let's begin. Okay, today we're going to be talking about hypertension or high blood pressure, also known as the silent killer. My name is Jaime Mesa. I'm a medical doctor I've done most of my job in the emergency room. That's what I like to do. Also in preventive medicine. That's why I like to do certain talks about certain preventable diseases, like in this case, hypertension or high blood pressure. When we talk about hypertension, what is the situation right now in the United States? It's very much the same in the whole world, but this is just for the US. I would say it's the rule of three. 1 out of 3 adults suffer from hypertension. 1 in 3 of those patients with hypertension do not know they have the disease. And 1 of those 3 who do know and are treated for that actually are not keeping their goal of the adequate blood pressure. So I think that's something alarming. In America, every day in the United States, something between 1,000 and 1,100 patients die every day. So it's actually one of the conditions that kills the most people in the world. What is hypertension? What is high blood pressure? Well, the obvious first, it's the pressure of the circulating blood through the arteries. It's simply too strong. So it's like the water in the pipes in our house. Simply when it gets too high, the pipes might break down. It's something similar to this. It happens because of arteries, they start getting stiff or rigid. It can also happen because something is causing those arteries to contract or not to relax the way they're supposed to. And it can also happen when there is simply too much circulating blood. The same thing, if you put too much water in the pipes of your house, probably it's going to break the pipes. We have 2 types of hypertension, what we call primary and secondary. Although they have a mix between these 3 causes, I would like to say that mainly primary hypertension, it's the one that is caused because arteries start to get stiff or rigid, and the secondary hypertension happens for the other 2 reasons. I would say this seminar will be more focused on primary hypertension more than secondary, because secondary hypertension it's a result of another condition. So primary hypertension is the one that it's by itself, not related to other condition, and it's the one that most people have. There's a little picture right there of a little schematic of how the circulatory system works. You can see there a little like bag which represents the heart, and how each time the heart pumps blood, the arteries have to expand, they're elastic, and then that way they help the blood flow. But when something makes the arteries rigid or not elastic enough, then the flow in those, the blood flow starts damaging the walls of the arteries. Who is at risk of having hypertension? Well, first of all, everyone is at risk, and the risk increases, or the chance to have it increases with age. If I could show you certain numbers, you would see that probably when we reach 65 to 70% or more of the population of the earth will have high blood pressure. So that means less than 1/3 will not suffer it. So that means this is something that probably most of us are gonna have. Diabetic people have an increased risk because diabetes is a condition that affects directly the certain layers of the arteries, causing them to be less elastic. And as I was telling you, that's the most common cause for high blood pressure. So of course, diabetic people are have an increased risk of having hypertension. Smoking. I guess smoking is going to be one of the risk factors for most conditions right now. I think it's one of the factors that it's causing more and more deaths a year, not only because of cancer, but because of the whole other conditions it is related to, including, of course, in this case, high blood pressure. Sodium intake, and a high amount of sodium in your diet, or a low amount of potassium, is related with high blood pressure. And that is something related with the kidney that I might explain a little bit further. But it is definitely related. Of course, not that common, but also very important, the use of certain drugs, especially cocaine, because cocaine simulates or acts in a very similar way to adrenaline, which is a natural hormone that the body produces when you are in a stressful situation, like in a fight or flight situation, when you're at risk, at danger. So it rises your heartbeat and your blood pressure. So of course, people that are constantly using cocaine, they will start having many problems. Among them is going to be high blood pressure. And obesity, that's together with smoking, I guess, one of the things that's going to be appearing in most conditions right now. And it's a global epidemic right now. And sedentarism, like if you have a sedentary lifestyle, not moving in the couch all the time, just going from your bed to your couch, from your couch to your car, and then that's basically all you do, you're gonna have a greater risk of having hypertension. What are the symptoms? This is a question that I would like all of you to ask yourselves and try to answer that in your mind. I'm gonna start saying certain things that my patients say: headache, like hot flashes, and dizziness. Well, what do I have to say about that? I would say no, and no. That's false. And I want you to understand something. It's not that if you are hypertensive, you cannot have a headache. Of course. But definitely those are not the typical symptoms or that is not something you should expect for you to know that you have hypertension. Usually, the most common thing you're going to find with hypertensive patients is nothing. Remember, I titled my seminar, my webinar, The Silent Killer. And that is something that I like to explain to my patients. And I think it's one of the most difficult things we have with high blood pressure, because it is difficult to fight something that is so silent, especially because for the patient, it's difficult to accept treatment for something they are not feeling. So if your car is not making any noise, it's not leaking anything, if your car runs perfectly, probably you're not going to take it to the shop or to the mechanic. But probably something might be happening, and in this case, it's something very similar. Why is high blood pressure so dangerous? I mean, it's something like I was telling you that many people have. It's silent. That means people live with that. Then why is it so dangerous? Well, about 7 out of 10 people who have heart attacks have high blood pressure. Okay, so that's 75% probably. 8, so that's even more. 8 out of 10 people who have their first stroke, they have high blood pressure. Heart failure, which is rising and rising. Heart failure, people whose heart it's not doing its job, it's not pumping blood the right way. People who start having their legs like swollen with liquid because the heart simply cannot do its job. 7 out of 10 people who have heart failure have high blood pressure. And it's not only that they have it, I mean, is that these conditions are totally related. So it is very, very dangerous to have it. How do I know I have high blood pressure? Well, again, you have to remember that this is very silent. You're not going to have any symptom. And if you have, probably it's going to be too late. If you have any symptom, it's probably going to be too late. But the best way we have to diagnose it is checking your blood pressure. It's obvious, but yet there's people that do not do it, or at least that they ignore the results. Now blood pressure can be taken in many different places: pharmacies, malls, shopping centers, drugstores. Well, in different places, not only on your doctor's office, in your doctor's office, which is a great place to do it, but you can even do it at your own house. So this is my recommendation. I think everyone should have a blood pressure monitor in their house, especially if you are diagnosed with high blood pressure, or at least if you had a reading that might suggest you have it. And this is what we want you to do. First, how to take your blood pressure. First, be still. Like when you're gonna do it, sit down, calm down, do not smoke, do not drink caffeine, do not do exercise or stressful situations for at least 30 minutes prior to the moment you're gonna take your blood pressure. Sit correctly. And how is correctly? That means you're gonna have a chair that's gonna have something for so you can put your lean your back against. You're gonna put your feet, and there have to be touching the ground. You cannot be in a chair that you're elevated. Your arms have to be placed on a surface also. And the arm that you're going to measure your blood pressure has to be leveled at the level of your heart, just like the picture I have there. Try not to have your legs crossed, so they're supposed to be uncrossed, and that's the way you should do it. Measure your blood pressure the same time every day. What we recommend to do it is early in the morning and in the afternoon. So somewhere between 8 to 9 a.m. would be okay. Even 10 a.m. would be okay. And somewhere between 5 to 6 p.m. you could do it. It is normal for everybody to have fluctuations in the blood pressure. It will start, you might have one measurement and then high measurement later. That's totally normal. Of course, you might already know that caffeine, exercise, alcohol, stress might elevate your blood pressure. That's normal. But if you take it twice a day, then we might have a better idea of like the average. You can even do it 3 times a day. If you want to do it, that's better. But the point here is that you're supposed to do it always at the same time. So choose your time and do it always at the same time. And take multiple readings every time you do it, at least 2 or 3, separated by 1 minute, one from the other, and record the results. That is very, very, very useful. Why? Because when you go to the doctor's office and you come to me and I take your vitals and suddenly I see you have a high reading for your blood pressure, I'm not sure if that means you are hypertensive, or that simply you are afraid of being there, or you are reacting to the situation, or maybe you just rushed from your car because you were going late or something like that. So we do not diagnose hypertension by one reading in your doctor, unless of course it's a very, very high reading confirmed in different measurements. But with one, it's impossible. So what we do is that we ask our patients to bring us the diary, the log of their readings at their house. And that's the way everybody's supposed to do it. Now there is something that is called ambulatory reading measurement, of blood pressure, which is basically what I'm explaining, but trying to standardize certain devices. So that is something I would like to suggest, that always you check that the device you're using, it's approved by American Heart Association or similar to that has certain standards, because not all of them have it. For example, wrist blood pressure monitors are not the best devices to use to diagnose it. Maybe to monitor your blood pressure once you are diagnosed, you could use it, but not to diagnose it. So what we recommend, it's a device that's fitted to your arm, to this part, not to your wrist or to your feet or not to your finger, because there's even some that can do that. These are the readings that we are looking. Of course, what I want you to learn right now is that normal, it's 120 over 80. And I'm going to explain a little bit more about those numbers and what they mean. Excuse me. Well, of course, if we're talking about pressure, those names have something to do with pressure. If you see there, you will see that there's an MM, an H, and a G, which means millimeter. And HG, it's the elemental name for mercury. So it's millimeters of mercury, because there are many different ways to measure pressure. You can do it PSIs, you can do it at pascals, you can do it at centimeters of water, but in this case we use millimeter of mercury. Back in the days, like probably 30 or more years ago, the blood pressure monitors used to have a little column similar to the thermometers that had mercury inside. So nowadays we don't use the mercury devices, but we still use the unit, which is millimeters of mercury. So the normal blood pressure is 120 over 80. Why are they two numbers? A lot of people might ask. What does it mean, 120 over 80? Well, we call the highest measurement, we call the systolic. That means what pressure is in the artery when the heart has contracted and pumped all the blood away. And then the diastolic pressure, which is the lower one, will reflect the blood pressure once the heart is relaxed. So we use both measurements, and that's why we have two numbers. We have, back probably 10 years ago, we didn't have that yellow spot there that's called pre-hypertension. Probably you were only going to find normal and high blood pressure, but we are adding that category because we want people to be extra careful if you're in that yellow spot right there on pre-hypertension. Now we are trying to be more severe, let's say that, with the measurements. We used to be very loose with our standards, like our patient was 125 over 85, and we would say, oh, that's normal. Now we have to be careful and say, oh, you are pre-hypertensive, so you have to start taking care, and you have to start monitoring yourself. So that's the first thing I want you to know. Normal is 120 over 80. And the second thing of that picture that I want you to keep in mind is that everything higher than 180 millimeters of mercury over 110, that's an emergency. No matter if you were ever diagnosed with high blood pressure or not, you should go to the emergency room right there, because you're in a high risk of having a complication. So then this is the moment where I talk about why salt or sodium has to do with high blood pressure. Well, as I was telling you, one of the causes of having high blood pressure is having a lot of blood. And that sounds like weird. Why would we have more blood than normal? Wouldn't the body just get rid of the extra blood? Well, for the body to get rid of extra blood, it has to take that blood, take it to the kidney, and the kidney will make it urine, and then will get rid of that extra volume of blood in the urine while we pee. But salt goes to the kidney and prevents the water to exiting the body. So the kidney tries to get rid of the water, tries to make more urine, but the sodium blocks the way water it's secreted from the kidney, and also helps actually reabsorb extra water. So you will start having what we call liquid retention. You start retaining fluids. That means your feet are going to start getting swollen, your hands. You will start noticing that your rings are a little bit tight, and that's the reason. Now, how do we treat it? And this is very, very related to that. First, I have to put here medications. I try, when I talk about treatment for the many conditions I talk about, I always try to put medications last. But unfortunately, in this case, I think it has to be first. I mean, so many people are having it that we are now aware that this is just part of the normal behavior of the body, how it is reacting to the changes that we have made, because we're not supposed to live this long. The body is not made to live forever. But since the medicine and the conditions of life are improving, we are living longer. So eventually we're going to start having certain conditions. So it is not very possible to simply get rid of this with anything different from medicine. Of course, you can prevent it and you can help medicine, but definitely the medicine is the number one thing in this condition. We use different types of medication. Of course, diuretics, which are water pills, commonly known as water pills, is one of the best medicines we use. Very obvious, related to what I was saying. So it goes and acts in the kidney, helping it get rid of the extra water. So if you have less water, less blood pressure. And we also have certain medications that act directly in certain chemicals that help with the contraction and relaxation of the arteries. It's also helping the arteries be more flexible like that. I mean, there are several types of medication and several ways of how they actually do that. I don't think that's something you would like to hear about, but basically they act either in the kidney or directly in the arteries. There's something that is called the DASH diet, and if you are hypertensive and you haven't heard from this, that this is definitely something you should research a little bit more. It's DASH. It's simply what the American Heart Association and many other associations, including the Task Force for High Blood Pressure, recommends nowadays, which is of course low in sodium and high in potassium, or at least this is a good guideline for what you should do. I recommend the DASH diet. Weight control. Definitely stop doing the things that are causing. Do exercise, eat the right way, quit smoking, and have a good diet. Basically, that's it. Now we'll give time for some questions that I really enjoy, and I hope you have questions for me.
Dr. Mesa, when you said DASH diet, do you mean that DASH seasonings that they said have no salt?
No.
Is that what you're referring to?
No, I mean, I refer about a diet that it's called DASH. It's like acronym for well, something not related with the diet itself. You're not gonna find out what it is, but you should look for it on the internet. It might tell you, and of course your doctor should be telling about it, but you can find it under DASH dash. There are certain recommendations of how many or how much, of certain types of foods you should be doing. It's like any other diet, but this is just special for people with high blood pressure. You should do it. It also helps a lot to lose weight.
Oh, okay.
Dr. Jaime, I suffer from high blood pressure. I'm on medication because, like you said, it's a silent killer. I had a heart attack. What I've noticed for a couple of weeks now, in the mornings when I wake up, my pressure is a bit higher than it usually was. It's not 180, it's like 137, 140 over 70, 73, 74. But I'm still kind of worried. Why is it higher in the morning after I've just woken up?
Well, there might be several reasons. Reason number one is that usually just when you wake up, it's going to be one of those times in which for everyone blood pressure is higher. Blood pressure is related to the pressure of the atmosphere.
Mm-hmm.
So as certain things change in the atmosphere throughout the day, the body has to react to those changes. That is the first reason. So that might be normal. And the second reason is that most people either take their blood pressure medications in the morning or at night. So that means probably just when you're waking up, the effect of the blood pressure medication is starting to wear off. So probably that's another reason why you might have higher blood pressure in the morning. But those numbers that you're telling me, for a person that's already diagnosed with high blood pressure and had heart attack, it's not that bad. I mean, for you, probably 140 over 90, it's acceptable. But only in your specific case, of course.
Okay. No, it's never reached 9. It's always in the 70s or the 60s. I guess because
better.
Yeah, I guess because I'm on medication also.
Right.
Okay, thank you, because I was kind of worried.
Dr. Mesa?
Yes.
I noticed that whenever you go to have your pressure taken, they always use your left hand as opposed to your right hand. Is there a reason for that?
There is a reason. Actually, if you go to your doctor, one thing is to take your blood pressure by yourself, and another one is doing it at the doctor's office. If you do it, if the doctor does it, ideally he actually should be taking it in both arms, or at least if you had an abnormal reading in the left, they should also try the right. But the reason why we usually choose the left arm, it's and there's an anatomical reason for that. The heart, the arteries that go to the left arm have to go through less. I mean, the path is shorter to the heart than the arteries of the right arm. So that means the measurement it's more accurate. But it shouldn't be a lot of difference between the left and the right. But we choose the left because of that reason. But if somebody, I mean, we have patients that do not have a left arm or had a surgery and we cannot use it. So it is also acceptable somewhere else. But the reason why we choose it, I already explained, is because the arteries have a more direct pathway from the heart to the left arm.
Okay, thank you.
You're welcome.
What, Dr. Jaime, what is it about the smoking that causes the arteries to be rigid?
Well, there are several factors that are there. It's not nicotine. Probably it's the least thing that people should worry about. It's more about the other chemicals that they use to create cigarettes, to make cigarettes, that they simply start to accumulate in the walls of the arteries. And the artery is different. The veins and the arteries are both tubes. The difference between veins and arteries is that arteries have muscle around it, a lot of muscle, so they can expand and contract. And certain chemicals in cigarettes start damaging those cells, and simply the tissue will be able to contract because the muscle will still be okay, but the walls won't be able to expand. So if there's a lot of pressure and you cannot expand, it will simply break. That's why people have strokes or heart attacks, because of the high blood pressure. And if you smoke and more chemicals start to accumulate in your arteries, then of course the worse your hypertension is going to be.
Okay. Dr. Mesa, question. Is there such a thing as white coat syndrome? Because I have a relative, they would take their blood pressure at home and everything is normal. And as soon as they get to the doctor's office, it is elevated. And also, is hypertension at a rate where we may think that it is out of control?
I didn't understand the second question. Can you repeat it, please?
No, I'm asking if you think that it is probably like epidemic stage, whereby it may be out of control, hypertension.
Right. Okay. I'm going to answer first the first question about the white coat syndrome. Definitely, it exists. That's the reason why we stopped diagnosing people just by taking their blood pressure at our offices. We prefer them to monitor their own blood pressures at home. And I don't know why I don't know why exactly. I guess some people get a little bit anxious or afraid when they go to the doctors. I'm not really sure why, but it happens. It happens all the time. I see it all the time. My patients that I know they're actually doing it well at their house, they bring me their logs, everything's perfect, but right there in my office, it's 150 over 95 or something like that. So it's normal, and it does exist. And I don't know if I did understand the question, but I think right now there is an epidemic of high blood pressure. I mean, I would say it is the most out of control condition right now. It is still rising. Like I'm telling you, just to know that 1 of 3 people has it, and of those, 1 is without treatment, and the rest, 1 of those who are at treatment, it's not controlling. That means you can make the numbers about how many million people in the world are going to die because of that. So you take that versus cancer, versus even car accidents, violence, you will find out that this is probably number 1.
Oh, okay, thank you.
You're welcome.
Dr. Mesa, can kids have hypertension?
Of course. Hypertension in kids would fit. Remember at the beginning of my presentation, I talked about primary hypertension and secondary hypertension. Primary hypertension is the one that you develop with age. So that means nobody under 30 at least should be diagnosed with primary hypertension, because they're young, their arteries have no problems at all. So probably if a child has high blood pressure, it's because they have another condition that may be causing it. So different from the primary that we just diagnosed it and we treat it. For children, we have to run a series of studies until we find the underlying cause. Kidney tumor, a brain tumor, something like that, an abnormality with the arteries in the kidneys, something else is happening there that we have to find out. So it's not like diagnose it and treat it like the primary. This is diagnose it, treat it while we discover the underlying cause and then we fix it. That hypertension can be cured. Primary hypertension, no. If you start taking medication for high blood pressure, once you are 45, 50, you're never gonna stop. You might feel well, but remember, this is silent. You never stop. For secondary hypertension, yes, it has a cure.
Thank you.
You're welcome. Okay, well, thanks everyone for your questions. I really enjoy them. Thank you for being here. Thanks again, Brightbot, for this opportunity and for the past and future seminars. I hope we can meet in the next seminar that I do. And please keep on asking your questions. Thank you. See you in the next seminar.